presentation is Clinical Outcome and Financial Distribution of Trauma Care at a Level 1 Verified Children's Hospital. Alder presenting.
Thank you. Good morning. For many of you know, the Children's Hospital in Dallas is a large urban pediatric specialty center that takes care of all aspects of sick kids. One of the things we're able to focus on is the care of the injured child. At our hospital, we see about 1,500 patient admissions a year. We have a tremendous opportunity to serve a region as a American College of Surgeons verified trauma center. And the documented improvements in outcome when care is provided at one of these verified centers is very robust. The literature is very specific about this. Some things in medical care have changed recently. The Affordable Care Act was passed in 2009 and upheld in 2012. And what it really does is it changes a lot of the financial focus. It changes us from a perspective of individual patient linked to a specific amount of money to a population-based accountable care organization type model. There's no data about what effect this will have on patient care, patient outcomes and things, and there's very little understanding about what effect this will have on trauma care in children. And so what we attempted to do was to review our experience and sort of see how the charges and the money flow in the patient population of trauma, of injured children. What we did is we reviewed our trauma registry and linked it to an administrative database that allowed us to assess for charges. Cost and reimbursement are really sort of the third rail in looking at this stuff, and so those things were not available. But what we were able to do is to link things like if you were admitted to the pediatric surgery service versus the orthopedic service, and then really drill down on the details of what the money was being charged for, whether it was CT scans or bed charges or those sorts of things. We were not able to get physician charges because of the many different aspects in trying to get that information. So physician fees are not included in this data. There are a lot of details when it comes to the information we got, and I don't have time to go over that, so I just want to show you a couple of important things. First off, we're talking about a lot of money. The grand total over this 2-year period of time was almost $110 million in charges. This is going to be a huge thing, especially when you consider that in kids, trauma remains a leading cause of death and morbidity. I don't need to get into the details here about what everything is, but just to get a sense of that, a big chunk of the money is charged for perioperative care. There's CT scans and other radiology things, and then bed charges make up a big thing. This is everybody combined. When you start looking at individual service lines, these pie charts begin to look very different. So for example, the two major trauma admitting services at our hospital are the orthopedic service and the pediatric surgery service. They account for over 90% of these admissions. But when you look at how they sort of split out when it comes to the way the money is spent, you see tremendous differences. And so as we transition from an individual patient related to the way that the payer is thinking about them to a population-based payer thought process, it's going to be important for us to understand differences in the way that these populations look. So to conclude, pediatric trauma remains a critical area of our practice. It remains a huge public health and a major medical issue. Sweeping changes are coming when it comes to thinking about the way that medical care is provided, the way that medical care is paid for. Charges that we're talking about are meaningful amounts of money. These are not trivial things. And there's going to be, as we get into this, differences amongst the populations that we're talking about. Thank you.